Hi guys, my name's Danielle. I'm an ITP patient. I've had ITP for 5 years and I'm the founder and CEO of ITP Australia. Our key objective at ITP Australia is to communicate with patients and facilitate communication between patients and the various stakeholders as well, whether that's clinicians, patients, politicians. Our job is to make sure that our ITP patients have a voice and that they're heard and that they're actually considered when decisions are made. We have our website, itpaustralia.org.au, and this website gives patients, and especially newly diagnosed patients, a chance to find out a little bit more about ITP because without the website, information is coming from the UK and the USA. While the information they provide is absolutely excellent, it doesn't necessarily mean it's relevant here in Australia. We have different treatments, we have different protocols when it comes to what treatments are available and why, and our patients are really using the information to arm themselves and to educate themselves around the disease and to make sure that they're getting the right information and the right treatments from their clinicians. The patient survey that we're currently running gives us a bit of insight into the patients here in Australia. We're asking them to share information about them, the treatments that they've undergone, a little bit about their patient journey, their quality of life, and a little bit of information as to what we can be doing more for them. It gives us a bit of a baseline for future work that we do, for future surveys that we can run, and gives us an understanding as to who's out there and who we're really talking to. I was diagnosed with ITP in July 2015. It was a chance diagnosis. I had a full blood count when entering into the emergency department of my local hospital. I felt fit, I felt healthy, and then I was admitted into the oncology ward surrounded by clearly visible sick people. ITP is an invisible disease and I'd clearly been suffering from ITP for a number of years. I have always said that I bruise like a peach and have done for many years, even pre-diagnosis. Heavy menstruation, spontaneous bruising. Like my husband and I would joke, I'd get out of bed and spot the new bruise every morning, especially in the 6 months leading up to my diagnosis. I thought I had really bad dental hygiene. Every time I'd brush my teeth, my gums would bleed. So with the diagnosis came a lot of understanding as to why some of the symptoms were happening and why they'd been happening for a very long time. But there were a lot of other questions. A lot of other questions that I was asking myself, if these are the things that have been happening and I've not known about them, what else is there? So I was lucky to be diagnosed by one of the best haematologists in the country. So I was in the right place at the right time. He put me onto a clinical trial fairly quickly, which was sensational. And that treatment worked for 3 years and worked really well. I was steady, my counts were great. I had very minimal symptoms other than fatigue and spontaneous bruising, which you generally tend to live with. I was working full time, living a very full and healthy life. But then after that 3-year mark, October 2018, the treatment stopped working. My count started to drop and spiral. We got to just before Christmas when I was told that my platelet count had hit 15. And that's when my journey really took off. I actually call it a bit of a roller coaster ride because it's exactly what it is, the ups and the downs. I was admitted into hospital many times because of my counts. It got to a point where I knew when my counts were low, I was dizzy, I was lightheaded, I was covered in bruises, and we're talking 40, 50 bruises, mouth ulcers and mouth blisters, and I would just head straight into hospital. We tried pretty much every treatment. Rob and I actually joke that I was destined to try absolutely everything, and I'm the better for it now because I understand each of the treatments a lot better, understand some of the side effects a bit better as well. Definitely don't wish it on anyone, but the vast majority of ITP patients go through it all the time. In the end, we ended up going for a splenectomy. Having a splenectomy was the last treatment on my list, and a lot of patients, whether they're here or overseas, are very adverse to having a splenectomy, removing an organ for a treatment that may or may not work, because you have lifelong impacts post-splenectomy. Unfortunately for me, the splenectomy hasn't worked. I'm still undergoing treatment now. Very light treatment. I'm very lucky in that aspect, and it hasn't impacted me greatly, my treatment now. I'm on a TPORA. But nevertheless, my splenectomy hasn't worked, and that's part of my journey. I'm in a much better place compared to where I was when the treatment stopped working. I'm in a much healthier platelet count. Physically, I'm much healthier. Mentally, I'm a lot healthier as well. But a lot of patients, they ask the question, well, if it doesn't work, what's next? And there are other treatments that follow on post-splenectomy, but I think it's really important that patients are heard. And I know personally, I didn't want to give up my spleen, and I don't wish that I'd kept it now, because it gave me the chance to get to my daughter's wedding in the UK. Without it, I would not have been able to get there. But I now have to live with antibiotics. I have to live with emergency antibiotics, and I haven't seen nieces and nephews for a long time because they're young and kids are full of germs and bacteria, and the last time I really interacted with them, I ended up in hospital because of a stomach bug. So it does impact, it changes your life, it really impacts on the day-to-day. One of the most rewarding parts about ITP Australia and being part of the organisation is being able to provide patients with information, but also hearing the relief, seeing the relief on their face, and empowering them to ask questions and learn more about ITP, and ask questions of their GPs as well, and their haematologists and their clinicians. Some of our patients want to get second opinions, which is okay too. I think that that's important, that patients feel safe and they know that they're getting the right information at the right time, and because they're the ones living with this disease, they're the ones that have to live with undergoing these treatments, whether it's end plate with injections or an oral medication, whether it's corticosteroids, they're the ones that are impacted by this. And it's really important that we provide them with accurate information, the whole picture. Unfortunately, like with social media and with the World Wide Web, sometimes you only get part of the picture. Our job is to make sure that they're getting the whole picture to then make an educated decision. One of the recent conversations I've had with a patient is that her clinician wasn't explaining things properly, not in layman's terms anyway. And this is one of the things, is we can sit here and talk about thrombocytopenia and L-Trombopag and all of these words and all of these names that I've become really familiar with through the charity. But you have to remember is that patients have never heard these words before. Patients have never encountered ITP before. So you've really got to, for lack of a better word, dumb it down. 12 months ago, I was lucky enough to be invited to become part of the ITP International Alliance and attended the meeting in Washington, DC last year. For me, the initial reason for starting the charity was just to provide information. After attending that meeting, I realised that there was so much more to do. around support and advocacy and helping patients, whether it be one-on-one or in giant groups. So I have hit the ground running, and we are doing so much more. We've had patient meetings, patient conferences. We're now holding virtual patient meetings, whether they be one-on-one or with 6 or 7 patients at a time. And we find that when patients come together and talk to each other, and we can facilitate that, they are leaving well educated. They're feeling connected with other patients because they don't generally find or have access to other patients any other way. Many patients go months, if not years, without meeting another ITP patient. So holding these forums is a great opportunity for those patients to not feel alone and not feel isolated. And one of the other things that that I love is being able to reassure patients and work with patients one-on-one to let them know that it's going to be okay. I was once asked if I could give patients one piece of advice, what would it be? And it will be okay. I'm not going to say it's going to be okay all of the time, and that is okay as well, but it will be okay. Things will get better. The version of you that you knew before ITP is gone, but it doesn't mean that you can't live a whole life, a full life, and be active. You just need to be safe. ITP Australia is partnering with Rare Voices. Rare Voices is an organisation that brings together rare diseases to provide them and us with a voice, and a much louder voice than what we could ever do by ourselves. We're currently providing a submission for a parliamentary inquiry to ensuring that we can get treatments that are readily available for other diseases to our patients, but not just to our patients, but to other rare disease patients as well. I think it's important that ITP Australia isn't just working towards treatments for our patients, which is a priority of ours, but that we work to benefit the greater good and to help others as well and help them take a step up when they can, because it's important that if we all work together, that we can achieve so much more. We can't do what we do at ITP Australia without your support, whether it's the information you provide us, the feedback you give us, or funding. We are selling pins, these ITP awareness pins. Pins will obviously help us raise awareness not just amongst patients but amongst clinicians and all other stakeholders, and all of the money that we raise from the sale of those pins goes towards helping patients and providing them with the information and the support and the advocacy that they need to improve their quality of life and improve their patient journey. They're $10, it's not a big ask, and wear it with pride, wear it with honour, and know that you're part of the ITP family and part of the ITP network. If I can leave you guys with just one last bit of advice, it's, let the patients know that they're going to be okay and that they're not alone. Send them to the website, itpaustralia.org.au. Go there yourself and have a look around and let us know if you think that we can be doing something different or need to make some changes. But the most important thing from a patient is that they need to know that they're not alone. Send them our way. We're on social media, we're on Facebook, on Instagram. My mobile number is available, my email address is available. We want to hear from them, and we want to make sure that they're not isolated and they're not alone. But more importantly, that just let them know that it's going to be okay.